This training will focus on how to do a patient search and how to navigate within the patient record. We will go into the training environment in just a minute, but first let's take a look at the different opt-in, opt-out consent status icons, so you will be able to quickly identify the patient consent status. When the consent is listed as opted out, such as in the last record on this page, you will not be able to access that record. That record is completely locked. The emergency access only is self-explanatory. The lock with the plus means that you can access it in case of emergency. When you see a person is opted in and there is a lock with a plus sign, that means that the record is sealed to you, but you can access it by breaking the seal. That is kind of a scary phrase, but all it means is that you are documenting your purpose for accessing the record, and we will talk about that in a little more detail. You have a couple of options for doing a patient search using the recent patients and the patient search links in the menu. When you launch NDHIN and it comes to your home page, you do have recent patients that are listed for you as well as your work list. You could click on recent patients again to refresh the list, but you can use this as a shortcut. Once you start searching patients, your lists will be populated to show you patients you have searched for the last 7 days, the last 4 weeks, and the last 12 months. And there will be different sections to show you that breakdown. In my recent patient list, you can see that I have 3 patients, and notice that there's a padlock with a plus sign beside James, but there is not that beside Mickey Mouse and Cameron test patient. This means that when I previously accessed Mickey's and Cameron's charts, I set myself up as part of their circle of care, so I will not be required to break the seal on their record each time I access them. If you are not sure whether or not to add yourself to the circle of care, just consider whether or not you will need to re-access that chart multiple times. When I choose to access James's record, you will see that I am asked to break the seal. And I could simply choose nurse and say break the seal, but I also want to demonstrate and show you the list of roles that are available. And if your role is not on the list, simply choose other, and then you will be required to document a note. And one example of this would be the Department of Health staff is using NDHIN for contact tracing. So I would enter my note, and now I can click on break the privacy seal. So this will take me directly into James's chart and take me to his patient summary page, and I will have access to this chart for about an hour. If I am working in a situation where I know I will be re-accessing James's record multiple times, I can go ahead and add myself to his circle of care by clicking on the circle of care tab. And then you simply click add, you choose friends and family or the care team. I'll choose care team. Here I would have an opportunity to click on my name, and then I would choose to subscribe to notifications for this patient. And if I did that, I would say add. I'm not going to do that because I want you to be sure to look at the inactive list, and I am on that list. So here, I'm going to click on my name and I will reactivate my relationship with this patient. So I said activate now, and I will click update. And it shows me that I successfully did that. And now the next time I want to go into James's record, it will not require me to break the seal. Now we can go back to the home page, and it will show you that that chart or that record is now open to you. So you can see that difference. If you want to verify that James is on your list of notifications, you can go ahead and click on that link in the menu, and it will show you the patients that you have subscribed to receive those notifications. So we've seen how to do a search using the recent patients shortcut. So let's go ahead and just do a general patient search. And when you click on that link, it takes you to this window, and you have an option to enter the patient record number. So if you know that, go ahead and enter the medical record number, but you do have to choose the facility that it comes from. So they have to match, and then you can click search. And you can only do a search using the medical record number or the name. You can't do both. Go ahead and put in Mickey Mouse. And if I had his birthday, I could enter that, and I will click search. And it brings up one option for me. And it's at this screen that I could easily add him to one of my work lists that we have discussed in a previous training. So you could easily add him to a list here. When I want to access his chart, I simply double click on that row, and it takes me directly into his patient record, again, landing on the summary page. Now, once you're within a patient record, there are a few icons that help you navigate around the record more easily. You could click on this colored tab, and there it allows you to add them to a work list if perhaps you forgot to do it. Again, you could always go back home if you need to. You can use this toggle to show or hide the main menu. If you want to close Mickey's record, you use this X, and that will close this particular record. It won't close the whole application. Again, if you want to be done with NDHIN, we want you to use the logout. And also, while you're in the chart, you can see this icon, which shows you that you have multiple charts open, and you could toggle between these records, but be very careful with that and make sure you are in the appropriate record that you need to be working in. And then you also can navigate easily around with using the tabs up here. So we will work our way through the menu on the left and then also the tabs across the top. As I said, when you open a patient record, you land on the patient summary page. And there are certain sections or windowlets that are displayed on each summary page. There's the demographics, the allergies, problems, encounter history, and the procedures. All of the information is read-only, and it is displayed as sent to NDHIN by the sending facility. This view will be seen by levels 1, 2, and 3. For users with level 4, the only thing they can see will be the demographics. In the demographics section, you will be able to see the multiple medical records that are sending information to NDHIN for your patient. You have your emergency contact and then other contact information. Allergies will show the actual allergy, the reaction, the date it was recorded, and the sending source. The problem list will be populated again as information is shared with NDHIN by the sending facility. Your encounter history section will show you admission, discharge, admit reason, discharge diagnoses, visit type, specialty, facility, and clinician. You are able to sort any of these columns. So if you know the particular date for an encounter that you were looking for, that might be an easy way to sort that. And you can sort each of the other columns as well. Perhaps if you know which facility they went to or which clinician, maybe you would need to search by that. You also can click on the magnifying glass, and that will give you some additional information. If there is no magnifying glass, there is not additional information to display. The procedure section, again, will be populated if the sending facilities have shared data with NDHIN that lets us know that this patient had procedures. Now we can take a look at the information that is available to be viewed. And there are some search tools available to help search for a particular report or document. You can use these icons to narrow your search by time. You can organize them by category, date, service, or author, and you can sort by date, title, and author. So if you have a patient who has a very full record with a lot of information to go to, if you know who the author is, or if you know the name of the report, perhaps you're just looking for serology and you can't find it. You could type in serology and it would bring up the one report that is available rather than trying to go through all of the documents. And to go back to normal, you just hit refresh and it will take you back to that menu. So again, we are on the patient summary tab, and we've gone through that. I'm going to skip the PDMP and NDIHIS for now. Let's have a look at the vital signs flow sheet. And this populates into what a typical vital signs flow sheet will look like. And you are able to graph any of this information. So perhaps you're following someone for their blood pressure and you can create a graph. So to go back to that, you can click on that link, or you could click on this on the side. Again, you can choose whatever you want and graph any of these results. And then we will go into the dynamic document, which creates a continuity of care document. So this is a dynamic document that is developed from all of the aggregated information that has been shared with NDHIN. All of the information is organized into one document, and it's sorted and populated again by different sections. So you can see by this icon, we would have to scroll through a long ways to get through this document. So it can be very large. You do have an opportunity to customize this. So if it's something you wanted to print, again, take a look at it, see how big of a document it is, and make sure you really want to print as much information as is available. The default setting is for 20 years, and so you can change that and maybe only choose, down to 3 years for each section. And maybe you don't want to include some information at all. So we could say no encounters and no results. And then we will say customize, and that will create a much shorter document. So perhaps you could even use this for a simple referral document. And you can print that. So go ahead and hit print and say okay, and then it will create a PDF, and then you click your printer icon. Okay, so that printed for me there, so I can close this document. And if I wanted to go back and re-customize it, it does default to 20 years. So that is one thing you do have to go in and reset that each time you wanted to change it. But this document, again, aggregates all of the information that you have for the patient in one document, so it can create one huge document. So that can be very useful. Next, we will look at our labs and the lab reports that are available in NDHIN. The lab folders are organized by the lab test type, and information is displayed as received from the sending facility, including their reference range. It will show you the date, the name of the test, the source of the information will be in brackets, and the ordering provider. You can see as I am hovering over some of the data points, you get additional information. So when you're looking at labs, we'll look at a chemistry panel. And when you see the 1 star, that means it is an abnormal lab. The red also indicates that it's abnormal. 2 stars means it would be critically abnormal. And if you see the little subscript notation, that means there's more than one reference range being reported in the labs. You do have an opportunity to graph these as well. So you just choose which one you want, and then it will create a graph for you. As you hover over information in the graphs or in these charts, you get more additional information as well. Moving on to microbiology, we'll have a look at what's in there. And this is where your urine cultures, wound cultures, and things like that will be housed. And so you will see the report again displayed as sent to NDHIN by the sending facility. The radiology section is for reports only. Images will be viewable under the image tab, and that is a separate training. But the radiology reports are sorted in the same fashion as lab. They're organized by the radiology test type, and the information is displayed as received from the sending facility. One thing I did not mention for the labs is when you have unread reports, those are displayed in bold. So if you see bold numbers, that means you have that many reports you have to go back and view. When looking at transcribed documents, keep in mind that because they are transcribed, they require a signature before the report will be shared in NDHIN, and you may need to allow some time for it to be available here. They are organized according to the name of the report. The information is displayed as shared with NDHIN. You can use the search tools to quickly find your document, and I will type in the name of the provider, click search, and it will quickly take me to the reports that are available by that provider. And I can click on it to open the report, and it will be displayed as shared with NDHIN. So that is a very quick way to find the document that you are looking for without having to wade through all of the different types of documents that are available.